Welcome back to At the Heart of Health. We're talking today with Heidi Bell. And the reason I asked you to be on the program today, Heidi, is you see a lot of health programs that are talking to the aged. You know, what should we do at the end of life? And we have such a healthcare crisis in America, and I think we got to tell your generation how to stay well. And I don't think we've done that very well, and I think they would listen to you more than they would listen to me. We're answering questions, but I had a personal question before we go on. What got you, Heidi Bell, interested in nursing when there's so many other things you could have been? You could have been a ballerina, you could have sang songs, or you could have done a lot of other fun things. Yeah. How'd you get interested in taking care of people?
Well, I started out in a different field in graphic design and realized that that wasn't for me, and that I wanted to be in a field that was able to help people on a regular basis. And it was a conversation with my uncle, who's a nurse practitioner, that just really got me interested in that particular field. And from that point, I just pursued it from there.
So as far as education, in case there's other young people that might want to pursue this path, you go to school and get your nursing degree first, and then you go on to nurse practitioners after that? Yeah. That's a lot of years.
It is. It was about 7 years altogether. It's a master's degree, and you can either get your bachelor's degree or just, I went straight from associates to master's.
You know, I think this is going to be a big issue in our country as we have less and less primary care providers taking care of all of our people. One question that I had is, what are different things that nurse practitioners do that regular nurses do not do?
Well, it's a completely different approach, actually. Whereas nurses pretty much follow the orders of the doctors, the nurse practitioners give the orders. Okay. They're the ones to diagnose the patient, prescribe medications, start a treatment plan based on history and physical.
Wow, so that's very neat. And today we've been answering questions, and I want to get back. Before the break, we were talking about breast augmentation, and you mentioned that they had to be replaced and all the risk of this. I think this is a big deal because we have a whole generation that might be doing this. But in approaching, if this mom came to you with her daughter, how, you know, you've talked about all this risk. Is there anything else you might add to dissuade them from getting breast augmentation?
Certainly. The thing to think about really is why would you be getting the breast implants? Is it because you have a low self-esteem? Is it because you want to feel, you know, better about yourself? Or is it because you feel like that's the only way to get attention or get a boyfriend maybe? Okay. But it's important to realize that this isn't going to solve all the problems. It's more important to get to the root of the problem and find out why there is a self-esteem problem.
Okay, now let me jog your memory back a few years here when you were dating, okay? You met your future husband, okay? And I'm not saying this would ever happen. He comes up to you and says, Heidi, I really want you to get some breast implants. Yeah. You know, because this happens. Men are sometimes like that. What would you, what would you advise someone to say? I mean.
Well, I would say that a person like that who is so focused on that, I wouldn't want somebody like that.
So you say take a hike.
I would.
Okay, well, okay. Yeah. Well, that's a good, because some women are not doing that now. They're doing it for all the wrong reasons. So I think that that's a good answer to that question, is see what the real reason is you're doing it. And you know, God made you a certain way for a reason. Yeah. And let's move on to our next question here. This is a good one I think we need to talk about. Heidi, it says, she writes in, she says, both of my parents had health problems and are in and out of the hospital. So her parents are very, very sick. She's 29 years old, and she doesn't want to go down this road. She says, I have no medical background. You know, a lot of people don't understand anything about medicine or their bodies as being their greatest assets. What can I be doing right now? She says, I feel great. And I think this is important because this is a very mature question, because they recognize what their most valuable asset is. They want to take care of it. So if they came to you with this scenario, what would you tell them to do?
Well, that is what we've been talking about so far, is that what we do now affects what happens later. And so it's important to set up good health habits now. Eat 3 square meals a day, good healthy meals, exercise 30 minutes a day, most days that you can. Make sure that you are maintaining a good weight. Make sure that you abstain from alcohol, drugs, and tobacco. And those are just a few common sense things. But some more specific things, make sure that you are keeping your stress at a low level.
Right.
Make sure you use sun protection.
Now what are things that are stressing the 20-somethings these days?
Well, lots of things. Jobs can be stressful.
You know, right now the economy's
careers.
not doing well,
Exactly.
so I guess that would be a stressor.
Very much so. Also, maybe starting a new family, maybe buying a house, school, all kinds of things.
And they sort of add up. Now, how would you, let's say this young lady is having some of these stressors, what are some things she can do to lower those stresses?
I would say make sure that God is #1 in your life. And make sure that you just take it one day at a time, give it all to Him, and it'll fall into place.
Now, is there any special blood work or screening that needs to be done in a 29-year-old?
Certainly. Females, in particular, should have female exams every year, which includes a pap smear. It's a pelvic exam. It should be done at a gynecologist's office.
So even at 29, you should have that?
Exactly.
Okay.
Every single year from the time that you're 18 to 21 until throughout your life. And also just making sure your blood pressure is under control. If you have risk factors, if your family member has a history of maybe diabetes or cancer, it's important to start screening for these 10 years before that they had it, so that you can catch it in time. And more specifically, like mammography should happen. It should happen about 40, unless you have a family member that had a history of breast cancer, and then you'd want to start earlier.
So let's say her mom had cancer, breast cancer, at age 35. So at 29, she should have some screening?
Definitely.
Wow.
Yeah, she should, because the earlier you catch it, the better it'll be.
So right now, if she doesn't have a family history, she doesn't worry about the breast part?
She definitely should. We should do breast self-exams every month, and it's just you do it more frequently than a healthcare provider would, so it's more chance of finding something if you check it every month. Okay.
Now her family has health problems. Let's say her dad had colon cancer at age 43. Does that mean at 33 she should have a colonoscopy?
Colonoscopy, yeah.
Wow, and these are all things that can really prevent major problems. Now she gets it, it's really downhill.
No, the earlier you catch it, the better off you are. So really.
So prevention is not such a bad thing. How about, let's talk about behavior and, high-risk behavior.
Okay.
I've had some people that do some crazy things in their 20s. Would you counsel on this, or would you sort of say, listen, it's your life, do what you want, have some fun?
No, we're definitely not as invincible as we think we are. So I would say to make sure that you're using caution. Don't do crazy things. Make sure you wear your seatbelt.
I think that's a big one, because how many automobile accidents you hear where someone is not wearing their seatbelt? That's very important.
Yeah, it is. Make sure that you never, if you do use alcohol, never drive drunk. It's very important not to.
Those are all good things. Well, I guess the take-home point is some people don't even go to see a provider for years and years and years, and then they might have had a condition like blood pressure, diabetes for 20 years, which damages their entire body, and then they go and they're just messed up. We don't want that to happen to her, so hopefully she'll get this taken care of. And I bet you in your practice you're going to see a lot of, I'm hoping more people because of this will get in and get checked and do the screening things to prevent major problems. And my prediction is as healthcare evolves, we're going to see more and more emphasis placed on prevention. We have time to talk about one question here today, and I think it's very, very important. It says, I have low self-esteem and cannot seem to lose weight. And the weight issue is big in your age group. Where do I start? Where do I go to find help? Just some general suggestions, Heidi.
Okay. It's a really tough question because weight is such a hard thing to deal with. Once you do gain weight, it's harder to lose it. But I would say to start with a visit to a healthcare provider to just make sure that there's no underlying disorder that's causing the weight gain, or something that could be taken care of medically.
Now, like an underlying disorder, like what?
Like a thyroid disorder.
Okay, thyroid.
That's a possibility. And then from there, I would say to start on an exercise program, because that will not only help you to lose weight, but it'll also improve your mood and give you a better outlook on it. Also, I would say to ask God to help, because this is a very hard issue to deal with, and I would say that God loves you just the way you are, and He's there to help you and wants you to feel good about yourself.
But a lot of people don't see weight as a priority. but I would say that weight in this age group, in your age group, is a priority.
I would say so too.
And we don't do people enough help. You know, what do you think about these weight loss centers? I mean, that might be a place you would refer someone to, or?
I would more likely try more conventional ways first, the diet and exercise. And if somebody is just really
what they say, it's so boring, I don't like to exercise. How do you make it not boring?
You have to find something that you like. It may not be running, it may not be, you know, lifting weights, but if you find maybe a sport that you like, or going to the gym where there's lots of people, maybe having a workout partner.
Oh, that's a good one, yeah.
And just make sure that it's something that you like.
But it is a very important issue to get this looked at a young age. We have a few more questions, Heidi, but I just don't think we're going to have enough time today to get at them. But we want to invite you back another time. This issue in your age group is very important to be addressed, because I see people at older ages that if we had just had these discussions younger, we could have prevented major catastrophes. Thank you for joining us today on At the Heart of Health. If you might have questions, please send us an email at heartwiseministries.org, or you can write us a letter at Heartwise Ministries, P.O. Box 8, Ottawa, Tennessee 37363. And remember, at the heart of health is love. Thank you for joining us today.